The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak to a healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
Hey Thal Pals, it's your friend and patient advocate NinaMaria, and you're listening to Thal Pals, the Alpha Beta Revolution. Hello Kevin, it is incredible to be live and in person. We're live in San Diego at ASH, and it feels so good to be sitting in the same room as you.
Likewise. I think this is the first time where we're doing not just a live podcast, but live in-person podcast.
Yes, and with other guests, and it feels good. I'm so excited to get started with this awesome episode about pursuing classical hematology. And I think we'll let our guests introduce themselves.
That's right. We have two doctors with us today. We have Dr. Priya Chandrakumaran as well as Dr. Hayoung Roh.
So hi everyone, my name is Hayoung. I'm one of the, fifth year hematology resident at the University of Toronto.
And hi everyone, I'm Priya. Priya Chandrakumaran is my full name. I'm also one of the hematology residents, but actually at the University of Ottawa.
Welcome. It's so amazing to have both of you on Thal Pals.
It is. I'm so excited to pick your brains from, a new doctor perspective. And let's just start by, you guys picked hematology, right? Like I assume you knew you want to be doctors first, but what made you think hematology?
I guess it kind of goes back to where I kind of started. So just a little bit about myself. I started off with working with nonprofit agencies prior to medical school, and then kind of developed my passion in patient advocacy, empowerment, as well as, health accessibility from that point of view, and went into medical school. And while working with these organizations that are grassroots, I really found that hematology drew me in, not just because of their sciences, but because of the people as well as the patient population that's really diverse, and that ranges from young to old, goes from any kind of gender, and it can span really the generations of all the population that are being affected by hematology. Going from there, I thought maybe this is a natural extension of what my values lie, which is, thinking really about how to empower patients, and hematology really fit right into that, because I felt like I could serve people, serve our patients, and be able to support them throughout their journeys. And that is the reason why I'm really drawn to the red blood cell disorders or hemoglobinopathies, because these patients are actually living with chronic conditions for a very, very long time, going through so many different challenges, and while they're, navigating their healthcare themselves. So this is the reason why I wanted to be a hematologist, and also kind of have an interest in the hemoglobinopathies.
Awesome. Very inspiring. Priya?
Yeah, for me, I think, when you start medical school, there's so many specialties, there's so much to choose from. I think it really just takes a few passionate mentors along the way who really kind of inspire you, and who really, really kind of inspire an interest in whatever specialty that it is that they're doing. And I was lucky enough along the way to have met quite a number of people who have inspired my interest in hematology, and especially in the red blood cell disorders and thalassemia. I was actually lucky enough in med school as well to go to Sri Lanka to do thalassemia research. So that's one of the things I think early on in my training that really kind of opened my eyes to, the condition itself, as well as the whole kind of spectrum of disorders involving in the red blood cell disorders. So I think overall, I think the experiences that you have early on in your training really shape what you want to do. And I think the opportunities that you get along the way were really kind of inspiring to me and really led me down this path.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including PK deficiency, thalassemia, and sickle cell disease. To learn more about thalassemia, visit rethinkthalassemia.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising. That's Ally, A-L-L-Y, Voices Rising.
In hematology, have you guys decided kind of what your specialty will be, and what do you hope to bring to that? What do you hope to bring to hematology as a field, and what do you hope to bring to the future of that specialization?
Well, for me, I'm in my 5th year, which is kind of the final year of my residency, where I decide whether I'm going for the fellowship or whether I will be going into the community or academia in terms of my career paths. And I've been talking to Dr. Kuo, I've been talking to so many different mentors, and they've been helping me, supporting me throughout the way. In short, I'm still deciding, and it's okay for me to be deciding at this point in time, but I'm also applying to a fellowship in hemoglobinopathy, so red blood cell disorders, and thinking really about whether I want to stay with the University of Toronto and serve the people there. And also, because I love the community, I guess I love the hospitals in the greater GTA, like the greater Toronto area. I do think there's value in myself practicing both malignant hematology and complex hematology. So there's been there's a lot of thinking going through at this time. So at this time, I'm kind of in that pathway, choosing where I want to go.
Yeah, I think for me as well, I think I've kind of always been on the path towards, pursuing a career, specifically focusing on the red blood cell disorders and hemoglobinopathies as well. So similar to Hayoung, I also am hoping to do a red blood cell disorders fellowship as well and do some more training there and get more experience. I think for me, what I really enjoy about this is that you can, treat and help patients in your own local communities, but also I think we do and we can have a role in helping patients in the more global community and around the world. And I think that's what I hope to really bring to the table. I really hoped in the future to be more involved in the care of patients with red blood cell disorders, thalassemia, for example, across the world and not just in Canada.
So, Hayoung and Priya, one of the genesis of tonight's podcast was, remember back when we were doing the rotation together, you were in my clinic, and we were bemoaning about the lack of education in rare diseases, but in particularly in thalassemia. And so I want to sort of take us back to that original conversation and ask you a few questions around that. And the first question is, throughout your medical education in undergraduate medicine, so just for the audience's sake, this would be when you have finished undergraduate degree, and then after that, you would then go into medical school. So this is what we call undergraduate medicine. So during your undergraduate medicine, how much exposure to rare diseases, especially things like thalassemia, did you have? And what was your perception of rare diseases like thalassemia was at that time?
Yeah, so I think going back to undergrad, I think I would say that the exposure to rare diseases overall as a whole was quite limited. And I think the exposure to certain types of rare diseases specifically was actually even more limited than that. So I think depending on where you train and depending on what the demographics of the population you live in or where you're working in, I think that really influences how much exposure you have to those disorders. So, for example, I think there was a lot of emphasis in my undergraduate program, at least, on cystic fibrosis, for example. But we didn't really have as much exposure to red blood cell disorders or disorders even like sickle cell disease or thalassemia, as an example. So while we did have some exposure, I think which rare diseases they chose to focus on really was emphasized, was, I guess, dictated by where you live and also what the demographics of the population around you are. And I think that has kind of changed as I've moved to different cities and practiced in different cities as well.
Same. Honestly, my undergraduate medical education really had only a few weeks dedicated to hematology. And within the field of hematology, as you know, is so many different disorders. And within that, thalassemia or other hemoglobinopathies was a very small portion. So as medical students, we were only exposed to it maybe for a day, or even less than a day for an hour for sure.
Wow.
So the amount of information that we gathered from our medical education, especially as a medical student, is quite small. And our exposure to patients, if you're not in the center of excellence, like University of Toronto, for example, for red cell disorders, then you don't get any, pretty much. So I know that it's really variable depending on where you practice or where you train, but even where I was in Toronto for medical school, I didn't get that much.
That's incredible. Just from like a patient perspective, it's almost like scary because like that it resonates, because when I go to see like a general doctor or say, I need to go to the ER for some reason or something, I end up like explaining to those doctors what I have and what I need. And sometimes they're like intrigued, like this is the first person they've ever met, with a rare blood disease or thalassemia at that. And sometimes, it's like I tell them what I need and they almost don't believe me because they don't get it. They don't have that education. So it's just to hear, how little it's focused on from a general sense is remarkable.
And when you went into residency, so in internal medicine, did that exposure increase or was it pretty much the same?
Well, I have to say in internal medicine, because I'm seeking more experience in hematology, because I had a baseline understanding and interest in hematology, I did go out of my way kind of to seek exposure for hemoglobinopathy and red blood cell disorders. But for my colleagues who are going through the same program, they don't necessarily get that exposure. I've had, I trained at the Toronto General Hospital where there were, medical day units, and I've had, I had a great experience there, but I know that my co-residents who are also internists, like internal medicine residents, didn't necessarily get the same experience as I did, and I wish they actually had more exposure to hemoglobinopathies and the patients who are experiencing that and living with that, with the disorders.
I think I'll preface by saying, so I've trained in a couple of different centers. So I started with medical school in Toronto. I did my internal medicine training in Calgary, and now I'm doing hematology in Ottawa. So I think the exposure that I've had across those different stages has again changed depending on where I've been. So with internal medicine in Calgary, we had exposure to a lot of different hematologic disorders as I was rotating through my hematology rotation. But that being said, I think there was, again, less of an emphasis on the red blood cell disorders there, just by virtue of the patient population and the demographics of the population that I was living in. I think, that exposure in different centers really just depends on what we have and what we're seeing in the community. And so that really does shape what you're exposed to during your training. I do think that when I was in Toronto, I had a little bit more exposure compared to some of the other places I've trained in. And again, with the red blood cell disorders program in Toronto, there is a bit more of an emphasis on that. But for sure, in internal medicine training, I think that my exposure to the red blood cell disorders was lower. And I do find that when you're rotating through hematology, there's a very strong emphasis on dealing with some of the malignant hematologic disorders, which is great. It's amazing work that we're doing with patients that are living with blood cancers. But as a result of that, I think we do tend to end up with a little bit less training in terms of classical or benign hematology, including the red cell disorders.
I think they're often the forgotten group of hematology. I'm curious to know what it was like when you guys first met a patient with thalassemia. What was that experience like?
In one word, it would be inspiring, not because of, like the chronic disorder that she has been living with, but because of all the multidisciplinary work that we were able to empower patients with. So this was at the Toronto General Hospital, where there is a medical day unit, and we often see thalassemia patients with regular transfusions. So I saw a patient who was very young woman who had transfusion-dependent beta thalassemia. She was coming in for a regular checkup, as we do, and the doctors come meet them, and the nurses come meet them, and also if there are opportunities, our multidisciplinary team, including social work as well as the transition coordinator, also comes to meet them if they need to. And I had a chance to talk to her about iron chelation, so just to get rid of the iron that has accumulated from the transfusion itself. So, but we found out that she was not taking the medication that we had prescribed to her, months prior, and her iron level has been going up. Right? I had a long conversation with her, and the opportunity to do so is just purely amazing, just because the patients are going through the transfusion itself, and then I'm there talking about her life and the stressors in her life as well. And I realized that there are some significant stressors in our life that are preventing her from taking these medications, not because she doesn't want to, but because of all these things that are going on in our life. And realizing that and being able to navigate that, I told my preceptor at that time to talk together about the strategies and the management plan moving forward to support her, not just from a medical perspective, but from social work perspective, bring them in and just to help out with the finances, the barriers to care, like transportation, for example. All of those things kind of came together just to inspire me that this is something that people are living with. They have additional barriers to their care, but this is something that we are able to support them through as well, for as long as they are with us, right? So we then realizing that really was quite profound. So that's the reason why I was very inspired by this program overall.
I want to take a quick pause here and shout out to the audience who are individuals living with thalassemia. Many of you encounter trainees like Hayoung and Priya, and I must say I admire your courage, and I want to thank you for inspiring the next generation of doctors, and especially being able to pour your hearts out, talking about your problems with a stranger. That's no easy task. So thank you.
Yeah, I would say that the first time that I had met someone living with thalassemia was actually not in Canada. So it was actually in Sri Lanka. So to preface this my family's from Sri Lanka. That's where my parents moved to Toronto from. And so the first time I actually met someone who was living with thalassemia was in Sri Lanka, where it's actually more prevalent and more common, perhaps than even in Toronto. And so the first time I met someone was actually really quite shocking and eye-opening. And I think the thing that really kind of shocked me when I had met the first person I'd ever seen with thalassemia was the difference, I guess, than what we were taught in school. In places like Sri Lanka, for example, the patients are often younger and often don't make it into adulthood, actually. So we were seeing very much younger patients than I would typically see in a clinic in Toronto, for example. And you can really see the impact of the complications of the disorder, especially when availability of iron chelation may be even more scarce or scant in those kinds of countries as well. And so it was really eye-opening that you could actually see, physical manifestations of the condition that you might not even see in our patients living in North America. So I really think it was really eye-opening to have been able to go to a country where the disorder is prevalent, and they might not have the same access to care that we do have even in North America, and seeing the kind of heterogeneity of the presentations that you see with these disorders.
Is there anything that surprised you from any patients that you have met, in terms of, you learn one thing. It's one thing to learn and to read and to hear lectures, but in real time, in real life, is there anything that surprised you about thalassemia or any patient with thalassemia?
In our textbooks, when we have cases of thalassemia presented, it's usually the severe cases, the most extreme cases where, like Priya talked about, we have patients with, bony deformities, facial changes that are shown on our pictures, and that's the exposure that we get as medical students and as residents. And then we see our patients coming in, right, with the at our clinics where we realize that these are patients who are just amazing folks who are walking around and doing their daily living, but with chronic illnesses. And this is something that they live with the, like I said, the additional barriers that to their journey. So I do think that I was initially surprised, but I was also amazed, and really it did really inspire me about the managing their management of their own health, and the support that they were getting, and also the ways that they have been living through their journeys too.
Mm-hmm. I even feel a little bit inspired by your story with the first patient that you met, because it brings a point to light that it's much more than just here's the medicine, here's the treatment, take it, do it. There's so much more behind it. Thalassemia touches so many aspects of a patient's life, and we need doctors like you who are willing to sit down with us and talk to us. Let us tell you where the barriers are, instead of saying, well, just take your medicine. You ask why you're not, because there's more often than not so much more behind I just don't want to, right? There's always reasons, and tackling thalassemia, it takes every aspect of life. It really touches so much, and we need more doctors that are willing to sit down. It's a need, and it makes a difference in patient life and patient quality of life, for sure.
NinaMaria, that's something that they never teach in medical school, is diving into the journey of the individual, living through that journey. And can we teach that? What do you guys think? Like, is it teachable?
I think, while some of these are kind of knowledge and skills that you build over time when you care for patients, I think the most I've learned is actually from patients. And I think patients are our biggest teachers, to be honest, going through medical education over the last several years. I think you can learn a lot from patients, and just taking the time to sit down and actually hear not just the medical aspects of people's care, but also the social and everything else that comes into, that it takes to come into an appointment. I think we learn so much from just all of the other things, not just about the medications, not just about the symptoms that you ask patients, but everything else in between as well.
Yeah.
This is I guess my first patient interaction has inspired me regarding, learning about their stories. So I've actually taken that and have a project going on right now with the internal medicine residency academic half day. So we regularly meet every week, and one of those sessions are dedicated to having patient stories. And I've been leading that kind of platform in terms of bringing in patient advocates in their stories. And we've had patients with hemoglobinopathies talk about their journeys, their challenges, as well as their successes to our residents who are actually directly caring for them in our emergency departments and also in our hospital wards. And every single time I hear these stories, I am in love. I really, really, really feel that we can probably expand that into, more like this podcast, for example, and have more patient advocates come on and share their stories, because it's so impactful. And it's extremely profound, inspiring, and it's the conversations that arise from there. It's something else, like something out of this world, where everyone in that room, including the residents, including the patient advocates, they engage in that conversation. We lack that in our medical education, and I think there are so many opportunities for us to really see our patients as a whole person, and incorporating that moving forward. I'm hoping that I'll be able to facilitate it. But if someone across Canada, across North America, wants to take that on, I'm so happy to talk to them. That's one of the things that I'm really passionate about. So
That's incredible. I could tell, and that's such a beautiful thing to be able to bring to that. The medical field, a lot of it is science, but another aspect is connection and communication. I think that's something that we need to elevate. I think it's much more important than we let on. I'm curious to know if there's anything or what exactly you have learned from your patient interaction.
I've learned to listen, and I've learned to learn from their experiences and learn to not do the things that they have told me not to do, because we've all done it in our emergency department overnight. We've had, if you're an internal medicine doctor, you have so many different patients come in, and oftentimes you don't have enough time to spend time with our patients coming in. So what my patients told me when they share their stories is to, take a second and listen to us. And that's what I've been trying my best to do. So overnight as well, when taking that extra minute with the patient has made a difference in their care, and moving forward while they're staying in the hospital with us. And I see them back in our clinic again, and they've told me that they've actually been their care has been a lot better because of that extra minute that I have spent with them. So I think that's very meaningful. So absolutely.
I think so too. I'd like to echo everything that Hayoung's saying. I think that extra minute goes such a long way, and just taking that extra second to understand, patients' perspectives really makes a difference, especially, when we talk about, why is that person not taking the medication that you've prescribed. I think taking that extra second to listen to the perspective really changes, first of all, the dynamic between the patient and the provider, the healthcare provider, but also really allows you to build that connection and that communication between each other. And I think it allows patients to feel more comfortable with their providers when they feel heard and when they feel listened to. And you can kind of come together to make a plan that works for both people by just taking that extra second to listen and to really hear people.
So, Priya and Hayoung, if both of you have the opportunity to shape medical education, what would you change in the curriculum with respect to rare diseases like thalassemia?
I think, echoing what Hayoung was saying earlier as well, I think it really is important to have patient experience really highlighted in this. And again, I think bringing that in will really give us a more personal, a personal angle to the care of patients who have rare disorders. because I think that's how you learn, that's how you remember things. I think for me personally in my medical education, the things and the disorders I remember the most is when I've actually had a very personal interaction with a patient. And I think really having that really solidifies your knowledge both medically, but then also knowing how to care for patients holistically as well. So I think really encompassing that and really bringing in patient advocates into our medical education, especially when we're talking about rare disorders, I think that's really important. And as you were mentioning earlier, as a patient living, with thalassemia, oftentimes you're the one that has to educate providers about your disorder and what you've been living with. And I think it's really important that, hearing your opinion earlier on in our medical training and hearing your kind of how you've experienced the medical system will really be helpful in shaping our medical education.
Kevin, how does it feel for you to see the next generation of hematologists kind of come forth?
Well, I think I can just go home and retire now. Seriously though, I know we sound like we've overused this word called inspiring, but truly this is inspiring, right? Mm-hmm. Hearing the experiences from Hayoung and Priya on how interacting with patients, listening to the stories and journey has shaped their learning, but more importantly is moving the field forward, right? Mm-hmm. No longer are we in an era where we would prescribe a medication or treatment and just leave the patient be and then see you in 6 months, you go do whatever you need to do. Mm-hmm. It's a partnership, and I'm so pleased that there are very capable physicians, from this next generation, being able to carry that torch forward.
Good. I couldn't agree more. I feel inspired by your guys' stories and hearing the passion behind your voice for this field. It gives hope, for patients, and I think it's really important. I just have one more question, and that is, if there was a future doctor out there considering specializing in hematology, would you suggest it, and what's your advice for them?
I guess 100% I would suggest hematology. I've wanted to do this from the beginning, since very early on in medical school. I don't regret my decision at all. I think we care for such, again, like Hayoung was mentioning, a very diverse population of patients, and I think it's been inspiring again for us, and it's humbling, really, just hearing your experience and the experience of many patients along the way. I think my advice would be to explore everything there is in the field and, get to know people and these really, strong mentors who are really passionate about what they do, people like Dr. Kuo. I think it's really helpful to kind of get that experience from people who really have a passion for the disorders that they're treating early on in your career, to kind of get that guidance about how to proceed and how to really get involved.
Totally. I totally agree. Did I know that I wanted to do hematology? Maybe when I went through that few weeks of blocks of hematology when I first got introduced to it in medical school, but what really drew me in were the mentors like Dr. Kuo, and everyone along the way throughout medical school and as well as residency in hematology, because it's such a vast field. It's hard to know everything. What I would encourage the trainees who are going through the same process, if you love the science, if you love the people, if you love the patients, then go talk to whoever is the hematologist around your area. Talk to them, shadow them, and let them know that you're interested, and then they will definitely be happy to show you what hematology is. And they've already shown us, and they've guided us, and hopefully later down the road we'll be the people who will be guiding you too. So that's my advice for them.
So NinaMaria, I guess hematology is in Hayoung and Priya's blood after all, isn't it?
Yeah.
Final question to you, NinaMaria.
Yeah.
Would you have them as your doctor?
Absolutely. Honestly, you guys, your stories are incredible, and I can see the passion, behind your voice. Again, it gives me hope. We need more doctors like you. And my hope is that we do have more doctors like you.
So I can retire, right?
Well, again, it's been a pleasure having you guys on. Amazing conversation. And I can't wait to see what you both achieve.
Same here. Thank you so much for being here.
Thank you.
Thanks for inviting us.